Live.
Hi everyone, it's Shekinah Garner at Dr. Jason Emer's office in West Hollywood. I'm here with Jenna today. We are doing a facial. We did steam with enzymes to soften her skin. We did extractions, and now I'm using the dermal infusion to just really wash out her pores that have just freshly been extracted, and to also pull out any other impurities that I wasn't able to get with my hands. So you can see I'm using the dermal infusion tip, which is comprised of a plastic sphere around a little crushed black diamond tip pad. This pad is the abrasion part, which helps to slough off dead skin, and then fluids swirl around inside to just really wash out the pores. The solution that I'm using right now is a salicylic based solution, which is really great for acne, blemish prone skin. It really helps to calm inflammation and reduce future breakouts, and also heal current breakouts. This is a really great deeply hydrating treatment as well, because these fluids all contain a lot of moisturizing properties. So this is infusing the skin with a lot of hydration, as it's also deeply cleaning it.
How often can you get a dermal infusion treatment?
You can get dermal infusions weekly. For patients that have active acne, I recommend it weekly to just stay on top of their sebum production, because a lot of times when you have acne, you have an overproduction of oils, and this really helps to limit the amount that's building up on the surface of your face and causing you to break out.
And how does it compare to other treatments?
So a lot of people ask how this compares to hydrafacial, and it's different in a number of ways. One of the ways is the handpiece. The handpiece is, it has the pad that I showed you guys, that is the crushed diamond tip. Hydrafacial is plastic only, which I don't love. I've used both. I prefer this one. Also, the fluids that we use with it are different than the hydrafacial formulas, so that's very different as well. Also, another cool thing is this jar. It contains all of the dirty water, the dirty fluid that comes off of your face. You can look at it later. You can see all the blackheads floating around. A lot of people like to see that.
What is the treatment called again?
This is the dermal infusion, formerly known as the silk peel. And we combine this treatment with a lot of other things, like say we combine it with extractions, with steam, enzymes. You can combine it with the salt facial. We call that the silk and salt, and we do the salt exfoliation first, and then we follow it with the dermal infusion. You can do this before peels to deeply exfoliate your skin and clean it out and prime it for the peels, the different acids to follow. This is a great pre-event treatment as well, because it doesn't have any downtime. Her skin's a little pink right now from the extractions, not from the dermal infusion. How does it feel? Feels good? Like a little vacuum? Yep.
What is the aftercare like?
There's no special aftercare with the dermal infusion. We just always recommend you wear sunscreen, that you stay out of direct sun, just like with any treatment. But the aftercare should be set up for you by a professional. I like to set up the aftercare for my patients. Usually during a facial treatment, one of the final steps is a hydrogelly mask. During that time, I am able to jump on my laptop and create a treatment plan for you to start using at home. So the aftercare is usually determined based on different things that we talk about during the facial, and what I see with your skin, what I see your needs are, and what you've expressed your goals for your skin are. This is so great for around the nose. A lot of times this nose area is a tricky place to get, even with extractions manually. So this is a great device to really pull all of that out and wash these pores out. So we're going to do a hydrogelly mask, and then we're going to do the LED lights for acne to just kill any bacteria that could be acne causing. One more piece of the forehead. Okay, you guys, you can come back for the hydro jelly mask if you want in just a little bit.